Welcome to this video, where I'll be explaining everything you need to know about the US fentanyl crisis, from the beginning to now. Fentanyl is a synthetic opioid that is 50 times more powerful than heroin and can cause fatal overdoses with just a tiny dose. It has been responsible for a surge in drug overdose deaths in the US, especially during the COVID pandemic period, when people were isolated and stressed. In this video, I'll try and trace the origin, cause, and effects and responses to this deadly drug threat. What actually is fentanyl? Fentanyl is essentially a synthetic opioid that mimics the effect of a natural opioids like morphine or heroin, which are derived from the opium poppy plant. It is used legally to treat severe pain in cancer patients and in surgical procedures, usually in patches or injections. Opioids work by binding to the opioid receptors in the brain and other parts of the body, which are involved in pain relief, pleasure, mood, and breathing. Fentanyl is much more potent than natural opioids because it has a strong affinity for opioid receptors, meaning it binds more tightly and activates them more easily. It also crosses the blood-brain barrier faster than natural opioids, meaning it reaches the brain more quickly and produces more intense high. However, this also means that fentanyl can cause more severe side effects, such as respiratory depression, which can also lead to death by suffocation. It can also cause tolerance and dependency, meaning the user needs higher doses to achieve the same effect or avoid withdrawal symptoms, which increases the risk of overdose. However, it's also illegally produced and trafficked by criminal organizations, mostly from Mexico and China, who use it to make counterfeit pills or mix it with other drugs like heroin or cocaine. Fentanyl is cheap and easier to make than heroin, and it can be smuggled in smaller quantities across the border or through the mail. It is also extremely potent and addictive, which makes it attractive for drug dealers who want to increase their profits and hook more customers. Now, how bad is this fentanyl crisis? Well, here's some numbers. In 2022, the DEA seized over 50.6 million fentanyl-laced fake prescription pills and more than 10,000 pounds of fentanyl powder, which represents more than 379 million potential deadly doses of fentanyl. This amount of fentanyl is enough to kill every single person living in America, as the US population was estimated to about 333 million in 2022. In the same year, Customs and Border Protection, the CBP, seized over 12,000 pounds of fentanyl at the US-Mexican border, which is a 300% increase from 2021 and a 4,000% increase from 2016. How did fentanyl become a crisis in the US? The US has been struggling with an opioid epidemic since the late 1990s, when the prescription painkillers like OxyContin and Vicodin became widely available and overprescribed by the doctors. Many people who became addicted to the pills turned to heroin when the prescription ran out or became too expensive. In 2013, fentanyl started to appear in the illicit drug market, often disguised as prescription pills or laced with heroin or cocaine. This led to a spike in overdose death, as many users were unaware of the presence or potency of fentanyl in their drugs. According to the CDC, more than 500,000 people have died from opioid overdose between 1999 and 2019, and fentanyl was involved in more than half of those deaths in 2019. This crisis worsened during the COVID pandemic, when lockdown and social distancing and economic hardship increased the demand and supply of the illicit drug as well. From May 2020 to April 2021, more than 100,000 people died from the drug overdose in the US, a record high and a 30% increase from the previous years. Fentanyl was involved in nearly 3/4 of those deaths, making it the deadliest drug threat that the US has faced. Who is making these fentanyl and who is supplying? According to various sources, most of the fentanyl and fentanyl-related substances that enter in the US illicit drug market come from China and Mexico. China is the main source of the precursor chemicals that are used to produce fentanyl, such as the propionyl chloride, NPP, and ANPP. These chemicals are often legally manufactured and exported by Chinese companies as they have legitimate use in the pharmaceutical and agrochemical industries. However, some of these companies also illegally sell these chemicals to criminal organizations in Mexico or directly to drug dealers or users in the US, using online platforms, encrypted messaging apps, and cryptocurrency to evade detection and regulations. Mexico is the main source of the finished fentanyl that is smuggled into the US, usually in powder or pill form. Mexican drug cartels such as the Sinaloa and Jalisco New Generation cartels have set up clandestine laboratories with the synthesized fentanyl from the precursor chemicals they obtain from China or other countries. countries. The cartel then distributes the fentanyl across the US border, often mixing it with other drugs like heroin or cocaine, or pressing it into counterfeit pills that resemble prescription opioids like OxyContin or Percocet. The effects of fentanyl on individuals and communities. Fentanyl can cause severe respiratory depression, which can lead to death within minutes of exposures. A lethal dose of fentanyl is about 2 milligrams, which is equivalent to a few grains of salt or just the tip of a pencil. It can cause other health problems as well, such as nausea, vomiting, constipation, confusion, drowsiness, seizure, and coma. This drug addiction have ruined people's lives and relationships as users become more dependent on the drug and neglect their responsibility, health, and well-being. The worst thing is that it can affect innocent bystanders who may come into the contact with the drug accidentally or intentionally, such as children, pets, first responders, or law enforcement officers. You see, fentanyl can contaminate surfaces, clothing, or even equipment and can be absorbed through the skin or inhaled. How are the authorities and the government responding to this? Well, the US government has definitely taken severe measures to combat the fentanyl crisis, such as they increased the funding for prevention and treatment for recovery programs. They expanded the access to naloxone, which is an overdose reversing drug that can save lives. They enhanced the surveillance and data collection on the drug tendencies and outcomes. They strengthened the law enforcement and border security. They are also collaborating with international partners to reduce the production and trafficking of fentanyl, and they have also declared fentanyl as a public health emergency and a national security threat. Fentanyl is a deadly drug that has caused a major public health crisis in the US, claiming hundreds of thousands of lives and devastating families and communities. The US government and societies have been trying to tackle this crisis, but more needs to be done to prevent and treat and end this epidemic. Thanks for watching this video. Please like, share, and subscribe for more informative content. Stay safe, and I'll catch you in the next one.